Okay, you guys, take two. Trying to go to the doctor. I can't believe I did that yesterday. What was I thinking? I guess I was so anxious. I guess I was so anxious to get to the doctor and see what kind of, what kind of plan that we're going to come up with, that I just didn't realize that it wasn't yesterday. It was today, my doctor's appointment to the surgeon. Wow. Chemo brain. That is a big, huge example of chemo brain. Has any of you that have taken chemotherapy, have you done that before? I'm usually with it. I am usually the one that to depend on to keep everything straight, keep everything going, but not yesterday. Yesterday, I was a hot mess. I can't believe that we made it all the way up there, an hour from our house, just to realize, nope, the appointment's for tomorrow, which is today. All right, well, I will see you at the next step. Let's hope that the appointment, I get it right this time. Okay, so we got off to a good start. It is a rainy, cloudy day today. So I am 100% for sure that today is the day that we go to the surgeon. There's no chemo brain today. I have no idea what I was thinking. I have no idea. I was for sure that it was yesterday. So we'll find out today what the plan is, and I'll let you all know what the plan is for my breast cancer and what surgery we're going to go through and how it makes sense and things like that. So, like I said, technology, as you heard the radiologist doctor say, technology has came a long, long way from even 5 years ago. So it may be that I don't have to have a mastectomy, even though, I don't want to have to go through this again. I've came a long way. And although I may want the mastectomy, it may not be a feasible thing. I don't know. Technology may be advanced enough to where they don't have to take off everything. They could just do partial. I don't know. So we'll see what he says, and we'll make our decision, and we'll let you know what the decision is. But today is D-Day. I have no idea what I was thinking. So my daughter-in-law, as you can see, the seat's empty. She had to go to work today, so she couldn't come today. Mr. Christine is my chauffeur for today and my bodyguard for today. So we've got half the crew with us. But my daughter-in-law did make a video of the questions that she wanted to ask the surgeon yesterday. So we'll let the surgeon listen to what her questions are so that he can answer them. And we're going to make sure we ask him if we can record what his answers is so that we can play it back for her. So, so I'm looking forward to getting this done. We're one step closer, you guys. One step closer to being cancer-free. Woo woo. All right, so I'll see you guys when we get to the hospital. Love ya. Oh yeah, Mr. Christine also reminded me to tell you what my hair is. Look how nice this hair is. It is the same hair that I wore yesterday. It is the Selfie Mode by Raquel Welch in the color, and I think it's color almond highlighted or toasted almond, something almond. But look at how pretty this is. See all the highlights? Can you see the highlights in it? And you can actually see scalp. So this one is called Selfie Mode by Raquel Welch. So, and this is for those of you that are just tuning in and that don't really know my journey. This is a wig. This is not my real hair. I have no hair. I do have fuzzies coming in, and my eye. Look at My eyebrows are starting to come in. See that? And my eyelashes. See that? I got makeup on, so just so that you can highlight it. But look, it's all starting to come back in. Yay! I'm starting to look like my regular self. So, and every day gets better and better. My stomach is so messed up this morning, though. I got to drink a little bit of my coffee, but I couldn't drink it all. Ooh, what's that? Whoa! Somebody hydroplaned. You gotta be careful when it's raining. But my stomach is upset today, this morning, and I'm a little bit tired, but not like I was yesterday. Yesterday, I was so exhausted. So today's just a little bit better. So every day gets a little better every single day, and you just got to take it one day at a time and try not to get discouraged. I've got a surprise coming up for you all. I'm going to be making a new channel also. So I hope that you all subscribe to it. I'm not ready to introduce it yet, but I will be having a new channel. And as you all know, that I got terminated from my job, so it has something to do with that. But I'm not ready to launch the new channel yet or talk about it yet. But I definitely will. It's coming. But I want to make sure that I've got all my ducks lined in a row before I start to even introduce it to you all. So, and I know that you all wanted to support me. And I know that while I'm having financial problems, a lot of you have offered to help me and wanted to get me. Once I launch my new YouTube channel, you all can help me this way. So, and I'm willing to do that. I don't like to get anything for nothing. I like to give. If somebody gives me something, I'd like to give something in return. So stay tuned for that as well. But I will come back on when we get to the hospital and we'll find out what the surgeon says, okay? Love you all so much. See you in a little bit. Play beautifully.
Yeah, that will be one day.
Oh, thank you. Here, switch them.
Good. And our genetics was clean, correct?
Correct.
New lumps or bumps, new anything going on? How's that breast feel?
I can't feel it anymore.
You shouldn't. There's not much going on in your MRI. There was like a little tiny feather or something, but not much to write home about.
Good. So is that good?
Heck yes, that's good.
Everybody keeps saying that I'm going to have a miracle.
Well, our lips to God's ears, but so far so good. Things are going the way they're supposed to.
No, it's still working. It'll still work for
Oh yeah.
weeks.
Oh, chemo's still in our system, absolutely. You know, the shrinkage, just like a hot pot, you take it off the stove, it's still hot for a while.
And I can't feel it anymore.
No, and it's you know, there may not even be much left. The MRI is not a perfect test, it's not the mind of God, but it's pretty good. And they basically said this was just down to a little whisper of something. The lymph nodes were better too. No scabs, no moles, no drainage, discharge, anything like that.
Nothing.
All right, so we're basically ready to get to the operating room here. There's a time sequence on this, but let's play that out. All right,
6 weeks or something like
it's
that?
thereabouts, yeah. So here's the magic sequence here. It's normally 4 to 6 weeks to let you recover and let the damage still keep getting
Yeah,
done.
because I am still super tired and I am.
Well,
my
now's
stomach is-
not the time to operate on it. So what I'm looking at with this is I'm looking at something right after the 4th of July, right? So like fireworks signs and explosions and stuff here, stars.
That's what I'm hoping
That's
for.
kind of what I'm thinking. Now there's 2 things to accomplish in the operating room.
Okay.
We have to deal with the breast itself. So if you remember, there's a clip or 2 in there. I can't remember if they left 1 or 2 when they biopsied. So on that MRI, they just had an area that was just a little sliver. What will happen is, how far away do you live from here?
45 minutes to an hour.
So when you get here that day, they will put a wire in your breast. It's like a little human hair, and you will not feel that. But it helps me to what we call,
Okay.
yes, it's called a needle localization, so I can find this. You make an incision, and we remove a reasonable amount of tissue, but not too much. I want to take enough to get a diagnosis and make sure the margins are clean. On the other hand, I don't want to take out a ton of tissue. We take a picture of that in the operating room to make sure that it looks good, and then we send it to the lab. We get a report back on those margins in 2 or 3 days. We need to have clean edges to be done. 9 out of 10 times we do. If we don't have a clean edge, we have to trim that, but that's our intent is to get it clean. If it's all dead to start with, it won't be a problem. So that's step 1, is that lumpectomy. Step 2 is, remember we talked about lymph nodes, and we inject some special blue dye, and the first couple of these things turn blue like blueberries under your arm. We had something there to start with. Hopefully that's all dead. It's getting better on your pictures. But our goal in the armpit here is I want to remove as much as I need to, but as little as I can. As I said before, I don't want to leave anything behind. So when I get there, if I feel little rocks, I'm not going to leave them there. On the other hand, I'm not going to strip out every lymph node in there if it all looks normal. There's some blue urine that goes with that. That procedure takes about 30 or 40 minutes to do. We go to sleep for it, and we go home the same day. We will come back when our pathology report is back and go over the 2 results on that. From there, it's normally about a month until we do the breast radiation. So you're going to have a lot less doctoring going on as the summer goes on.
If that is bad.
Yeah, well, no, the dye just tells me what to look at. I'm going to be able to feel stuff too, but the dye tells me where to look. If it's already vaporized and it's all dead, I'm going to remove those and look at them under the microscope. I'm going to take a couple of days on that. But those tell me where to look. And then again, I feel around with my fingers too. I'm not going to leave something, a little white rock there that's not supposed to be there. So the lymph node biopsy is going to help us see if that has responded as well as your breast has too. We don't want to leave cancer under the arm.
I don't want to have to do this again.
No, we don't want to do this again. So this looks to be about the right time to do this. That'll give you time to feel good. I want you to sort of sail into this feeling great, not drag it into it like you just finished a marathon and you're going to run for another job.
So what is the difference between, so you're not recommending mastectomy. You think that I'm good enough to just do the
Your
lumpectomy?
MRI, definitely. MRI's giving us a shot to do that. Yeah,
Okay.
got to get clean edges to it, but the survival is the same between the 2. One isn't safer than the other. As long as you have clean margins on your lumpectomy, then they're
Okay.
equivalent. Yeah.
Okay.
The
In the last
technology has
5
come a
years.
long way, and if there are lymph nodes involved, they're going to add some radiation at some point in time, and we'll send you over to do that. But the radiation for the breast is not for what you take out; it's for the chance they're doing something somewhere else. So it's kind of a precaution.
Gotcha.
You have a good chance you could leave the operating room cancer-free. That's a good chance of that. You might even be there before we get there, but there's a good chance that we leave the operating room cancer-free if everything becomes a precaution. More immunotherapy, radiation; those are all precautions.
Okay.
You all right? Excited?
You just said cancer free.
You have a good chance of that. We will have to go through the dots, but that's the reason you did all this, That's the reason you did all this stuff.
Down here.
Sally's got it. Here's got it. She goes somewhere. Oh, crap.
Pray.
But that's what we're shooting for, and we'll know a lot more after we're done. But everything we've asked for, you've done so far. It's gotten better.
Tissues.
Yeah, Rachel wants to grab some.
But you just don't want to go through all this again.
No, nobody does.
Yeah.
That's our whole goal. Nobody wants to go through this again.
Make sure that's what I want to hear. Cancer free.
Well, we're going to do our best for that. We'll get a report back a few days later and talk to us where we are here. But you keep your spirits up. Enjoy the next couple weeks of feeling good. Do something fun. All right. Otherwise, God bless you. You stay well. Okay. All right.
Thanks.
We'll get her done.
Okay, you guys, so you heard it. I got good news. The doctor is very, very confident that I am going to be cancer-free after my surgery. The chemotherapy treatment has been doing very well and has shrunk my tumor in my breast and my lymph nodes almost to existing, like just a whisper of, the tumor still being there. So he's going to go in there and clean it up and take everything out. And he said, I will hopefully most likely be cancer free. Yay! As soon as he said that, I started crying because I've been through a lot this year. It's been very hard. I've lost a lot of things due to cancer and things that are out of my control. So to hear some positive news was just overwhelming, to say the least. What do you think, Mr. Christine?
Yay.
Tell us your take on what he said. Don't say his name.
Well, he thinks everything worked, and it's going to be small enough and that it'd be able to take it out and send it to the lab and check it, and then, like you said, be cancer free by then we can celebrate.
July 4th, yay! Also, they hooked me up with the nurse administrator who was going to help me with my disability. Deep breath with that. And so things are looking up, things are going well, and miracles do happen. I'm just so happy that I'm able to report back that this is good, a good sign. It's a good sign that positive things are coming my way, and my worries are almost over. Almost over. I'm still feeling very sick from the chemo treatment, and they said that sometimes it takes a whole year to get back to normal. But you guys know how I am. I'm very stubborn, and I push myself to the limits sometimes. But yay, can you imagine, cancer free? If that's not a relief, I don't know what is. Oh my goodness, I cannot, I can't wait. So yay, good news. All right, so we are going to be checking the P.O. box, and just to give you a reminder, June, the beginning of June will be, we won't have the P.O. box anymore. We just rented it for 6 months. So if you guys want to send some care cards, now's the time to do it. But watch for my new channel. Hopefully I do well at it. So if you guys want to support me over there at the new channel when I release it, I'm not going to release it yet, but I would so much appreciate it. So anyways, love you all so much. Thank you all for the prayers. Thank you all for the support, all the love, all the encouragement, and prayers do work. And leaving it at God's feet does work. You guys have been my prayer warriors. You have been praying for me, and guess what? Miracles do happen. It works. It works. Yay! So I'm going to insert the diagram that the surgeon wrote on while my consultation was going on, and so you can kind of see what he's been talking about. All right, love you all so much. Great news. Thank you all so much, and I will see you on the next video. Love you.